Hi, I'm Kristen McClure, and what I'm learning about today is antidepressants. So, last week I had a client come in trying to decide whether or not she should go to a psychiatrist to perhaps start a trial of antidepressants. But she trusted me, and she had a couple questions, namely, did antidepressants even work? Were they addictive? And did she have to stay on them forever? And I thought about these questions and I realized I didn't feel fully informed to answer them. And so um, I decided to learn a little more about these questions and um, share them with you on my What Am I Learning About video. So um, here's what I learned. First question: do antidepressants work? Now, I thought I know the answer to this question. Of course they do. Um, I've seen them work with my own two eyes. They don't always work, but many of my clients seem to get better. But last year, or actually a couple years ago, I saw David Burns, who's a famous CBT therapist. He's very well known, and he stood up and claimed that there was no evidence that antidepressants work. And I thought, that's crazy. He's crazy, and I'm not listening to him. But I often wondered, like, where was this coming from? So in my research, what I came across that was in 2008, there was a paper that argued that antidepressants were just a myth. And the gist of the article was that the results of antidepressants' effectiveness has been overblown, and positive studies had been released while all of the studies that showed that they were not effective had pretty much been buried. Really disturbing. And it looked like the pharmaceutical companies had a role in this, and that we weren't getting accurate information. 10 years later, there was another extensive review that showed that antidepressants actually were effective, not as effective as we would like them to be, and that they were primarily effective for people who had major depressive disorder and primarily effective in the short term. And this was the most comprehensive review to date. 2018, it was done. And you can see that in my article that I've written on this, and those articles are cited. So that was the review that I did to try to understand whether or not they're effective. And essentially, my takeaway and my answer to that question is that yes, they're effective, probably not as effective as some people would like to think. What's published is bias sometimes, and we are less likely to see the less favorable studies published. We as clinicians need to have an understanding of what we're reading and interpreting. And news headlines are not always reliable. So we have to read the research critically. So I plan to try to remember what I've learned in my research and statistics classes when I'm reading information. And research on antidepressants for every kind of depression is not solid. It's the most compelling for major depressive disorder, that's more severe depression, and antidepressants are likely not to help with mild depression. So they're not going to help everyone. So that's the answer that I'll give to my clients moving forward about whether or not antidepressants work. Okay, so then I moved on to the next question. Whew, are antidepressants addictive? Well, that seemed like a resounding no. Like, that was never a question in my mind, but clients will ask that a lot. It actually seems that the common public actually thinks that they are. So what I found was in my Evernote files where I hoard information, an article that seemed really well written and answered most of my questions that I had. Not a journal article. and I'm not a psychiatrist, so I'm just wanting to kind of answer some of my clients' general questions. The article was entitled "What I Tell My Patients About Antidepressant Withdrawal" by Dr. Jessica Gold. To sum up that article, Dr. Gold says, some people need to stay on their antidepressants forever, and some people don't. The amount of time you need to stay on your antidepressant depends on the number of episodes you have and the severity, according to this doctor. The more episodes you have had, the more severe the episodes, the longer you will need to stay on that antidepressant. So that seems like really key information. If you decide to get off your antidepressant, you need to do so with doctor supervision because of something called antidepressant discontinuation syndrome, ADS for short. And according to Dr. Gold, 20% of the patients who stop abruptly will experience ADS. That seems significant because a lot of my clients decide to go off their antidepressant without telling me or telling their psychiatrist. So that seems like important information for me to note. So I am thinking about that as I'm doing the research. So this ADS, this discontinuation syndrome, seems important for the question of whether or not antidepressants can be addictive. So I start to try to learn a little more about it. It seems that, from what I read, ADS can happen a few days after stopping meds, and for some can occur if you miss just one pill. This kind of jives with what I've seen with my clients. Like sometimes they'll miss their meds and they'll feel pretty crappy. And Dr. Gold says that you may also be able to predict whether or not you're going to have this syndrome. So some kind of antidepressants make it more likely, and the longer you are on your antidepressant, the more likely you are going to have ADS. So that all seems like helpful information to know. And then I go on to read another article about ADS called "Sorting Out the Antidepressant Withdrawal Controversy." And these doctors in this article, Osser and Pease, describe ADS as lasting 1 to 10 days and usually resolving within 2 to 3 weeks. However, some people report that it lasts up to 1 year. And it also seems to, according to Dr. Gold, have something to do with serotonin and the central nervous system. So that's all good information to have about what might happen when you go off your antidepressant, if you choose to go off of it. And like Dr. Gold says, you can choose to go off of it. You don't have to stay on it forever. So what is ADS? Dr. Gold uses a acronym, FINISH, and this stands for flu-like symptoms, insomnia, nausea, imbalance, sensory disturbances, and hyperarousal. These are the category of symptoms that may have to deal with what you go through when you get off your antidepressant. That doesn't sound fun. So does that mean that if you go through these things, which again, Dr. Gold says 20% of people experience, other articles I read said it's higher, does that mean that antidepressants are addictive? So, this particular doctor in this one article says unequivocally they are not addictive because she says you do not develop craving or a tolerance. Now, I go on to read more articles, and some professionals argue that you do develop a tolerance. And so there's some debate about whether or not you develop a tolerance. But most professionals argue that it's not addictive. because you do not develop craving and the withdrawal is not dangerous. So I guess there's all kinds of arguing about definitions and what qualifies as addiction and what qualifies as not addiction. But essentially, it's not disputed that you can go through withdrawal symptoms when you are getting off an antidepressant. And I found another interesting article called The Case for Discontinuing Discontinuation Syndrome, which was quite fascinating and argued that there was a serious effort by the pharmaceutical companies to use a misleading term. And this article says 40% of people have withdrawal symptoms when stopping antidepressants. So that's a much higher number. And it goes on to argue that antidepressants should be called, this discontinuation syndrome should be called antidepressant withdrawal. And the language of discontinuation syndrome was a deliberate attempt by the pharmaceutical company to mislead the public as far as what was going to be happening when they tried to get off antidepressants. And that failure to use the correct terminology was an attempt to deceive, and that has led to lack of informed choice by patients when they're deciding to use antidepressants or not, lack of appropriate taper strategies, and in fact, research shows 80% of prescribers discontinue antidepressants too rapidly, leading to problems, although most of those prescribers are GPs and not psychiatrists. And it's very challenging to find guidelines for appropriate taper strategies, although that is changing apparently in 2021. So this problem with having withdrawal symptoms when you're going off an antidepressant has created suffering in people. And there is this phenomenon of support groups being created among clients who don't have support from the medical community. And again, this is not the psychiatric community so much as general practitioners. And this is more of a result, it appears, of the research and the use of the term discontinuation syndrome and the attempts to not be honest about the seriousness and severity of the withdrawal symptoms. So there's an article on how there were 13 support groups on Facebook for people who were experiencing withdrawal effects. So that was pretty interesting. So here are all my takeaways from all the research that I did and trying to answer my clients' questions in the most honest and informed way that I could. Antidepressants can be helpful. I know this because I've worked with depression for a long time, but maybe less helpful than we think. Most professionals agree that antidepressants are not addictive, like street drugs and other like anti-anxiety drugs. But it is arguable and argued that you can build a tolerance, but it's not as dangerous during withdrawal, and there's no craving for the drug. Getting off antidepressants can be challenging for a good percentage of people, and they can have withdrawal side effects. And many people don't get off their antidepressants because of this. Due to the fear of being honest about the withdrawal from antidepressants, it seems that people have suffered unnecessarily, but perhaps because of big pharma and This may have translated into people getting on drugs that they may not have needed or may not have otherwise gotten on if they were more informed. And a doctor has to be very skilled in knowing how to manage ADS. And it looks like primary care doctors don't know how to do that for the most part, for various reasons. And finally, how will I use all of this knowledge? I'll caution my clients about getting off their medicine on their own, which I've already been doing. I'll suggest that if they're going off their antidepressants, they do so under a very skilled psychiatrist or a skilled psychiatrist, and not their general practitioner, because they're less likely to understand what they need. I will tell my clients that antidepressants are not known to be addictive. I'll tell my clients that people don't have to be on their medication forever, but some people are, and that's okay. And I may give them that self-article. And I'll caution them that when reading news studies, headlines are not always accurately interpreting research. I think that's really important. And we can fall prey to that too. I often get articles from people, family members in the email that will be proclaiming things about therapy or about medicine. And when I read it, I'm like, that's not what that article said. So anyway, I hope what I'm learning about today video has been helpful and made sense to you. And there's a link on my webpage that is about this too. Thanks for watching.